It's now 20 after the hour. The summer months are known as the 100 deadliest days for drivers.
Just imagine being on the road and seeing a scene like this. Would you be prepared to help someone out of a car after a serious accident? And what would you do if you were the one trapped and injured inside that car?
You know, it can be a life or death decision. Here to continue our 5 Minutes to Live series.
Fox News Medical A-Team Dr. Mark Siegel live from St. Barnabas Hospital Regional Trauma Center.
Good morning, doctor.
Good morning, Jackie. Good morning, Patricia. We're here at St. Barnabas Regional Trauma Center. Did you know that over 35,000 fatal car accidents in the United States every year, and over a third of people have alcohol in their system? Well, a lot of them in the area of the Bronx come here into this hospital. And I'm joined today by Dr. Ernest Patti, who's a senior attending physician here at St. Barnabas and has a lot of experience with car accidents. Welcome.
Thank you, Mark. Thanks for having me.
What happens if you're in a car accident? If you're a victim or if you're in a crash, what do you do?
Well, normally what happens is we worry about the severity of your injuries. Did the airbag go off? Did you get a concussion? Did you get injured where you're bleeding?
What happens if you're bleeding? Can you apply a tourniquet yourself?
Usually we say apply pressure. Tourniquets are usually reserved for very serious bleeding and are usually put on by medical professionals. But yes, I mean, if it's a serious enough injury, tourniquets have been used.
So if your arm is bleeding, you might take your shirt off and wrap it around there?
Sure. I would say that that's a possibility.
What if you think you have a fracture? If you suddenly feel pain in a limb?
Well, if you feel pain in a limb, obviously you shouldn't put or bear weight on it. A lot of times what helps is to immobilize it. You could use a book, magazines, a board in the car, anything solid that you can wrap around it and maybe just apply a scarf or a piece of cloth.
What if something's sticking out of you, like a piece of glass, if you get impaled on something?
I would never attempt to remove the item, because many times the first responders will bring you to the hospital with that item still in your body so that it can be removed in a controlled OR setting where the risk of bleeding or further injury is lessened.
Okay, so now you're here in the hospital. Ambulance has brought you here because, again, the EMS make these decisions. The paramedics decide who goes to the hospital. You come to the hospital, here you are. We're seeing you, Dr. Patti. What do you do?
We do a rapid assessment in the trauma bay. Basically, we worry about the A, B, C, D, and E's.
Which are?
Airway, breathing, circulation, disability, exposure. We look for all the injuries, and we try to address them based on the severity. Airways, obviously, paramount.
If I hit my head, you got a CAT scan over here?
Sure.
CT scan?
We do different modalities where we'll image you. We do standard x-rays. We also do CAT scans. CAT scans will give us a quick look inside your brain to make sure that there's no bleeding, no fracture, things of that nature.
You got x-rays over there?
Yeah, we have some x-rays right behind me. Yep, we have some plain films. These are the old-fashioned plain x-rays, still very valuable tools for ruling out fractures anywhere in the body.
What do you got over here?
Here we have some interesting items. I use a pelvic sling. You mentioned bleeding. Many times in an automobile accident, you can get a pelvic injury where you bleed internally. A pelvic sling like this, it's basically an old-fashioned binder. We put it around the pelvis using Velcro straps and tighten it up to compress and sort of stop the bleeding that goes on in the pelvis.
What's this thing?
This is my Easy IO. Careful with that, it's a power tool. What we do with the Easy IO is we actually take IVs and we put them in to bones. They've started this practice in the military. You'll take actually an IV needle like this and you'll put it on the drill and literally drill it into the bone. And that will allow us quick and easy access into the circulatory system. Most people didn't know that the circulatory system is also inside your long bones.
Large bore IVs, intravenous lines. If someone's lost a lot of blood, you want to get the fluid back into them right away?
We have a rapid infuser. The rapid infuser can infuse both saline and blood products within minutes and to resuscitate the patient.
Jackie, Patricia, back to you. You have a question for us?
Yes, Dr. Siegel, if you come across an accident like this, how involved should you get so that you don't do more harm than good?
That is a great question. Innocent bystanders see somebody driving into a tree. What do you do?
And it's the first thing to do. Call 911 and activate the emergency response system so the providers are on the way. Second thing is to take a scan of the scene. We always have to watch out for other injuries, such as, are other cars going to hit them? Are there falling trees, electrical wires? Are you near the water? Things like this that you have to take into account, which could continue the accident and make it worse for the people inside the vehicle.
Great answer. You can cause more harm than good. Guys, back to you. We're going to answer your questions, viewer questions on Facebook. Send them in.
Great information.
Thanks,
We appreciate
Dr.
it so
Siegel.
much. Life-saving information. In fact, Dr. Siegel's 5 Minutes to Live series continues tomorrow. He will be back with the life-saving advice on what to do if you fall off a ladder, especially during these summer months, something you don't want to miss.
Yes.
Imagine this scenario. Your car is on fire. You and your family are trapped inside. You only have 5 minutes to get everyone out alive. What do? Dr. Mark Siegel is here with a life-saving advice.
Ainsley.
Thanks, Steve. The summer months are known as the 100 deadliest days for drivers. And just imagine being on the road and seeing a scene like this.
Come here! Your car's on fire!
Wow, thankfully a highway patrol officer was able to pull the family from that smoking car. But what if there wasn't an officer around? Would you know what to do with your family? And what would you do if you were trapped in one car and someone was injured inside? It can be a life or death decision. Here to continue our 5 Minutes to Live series is Fox News Medical A-Team's Dr. Mark Siegel, live from St. Barnabas Hospital, which is in the Bronx area, in the trauma center there. Good morning to you, Dr. Siegel.
Good morning, Ainsley. There's over 36,000 fatal car accidents every year in the United States. Alcohol's often involved, and we see a lot of trauma as a result of that. In fact, we're here today at St. Barnabas' Regional Trauma Center. I'm joined by Dr. Ernest Patti, who sees several car accidents on a busy day.
Definitely.
Ernie, welcome to the show today.
Thank you for having me, Dr. Siegel.
What do I do if I come upon someone that's in a car accident? I'm a bystander. I see a car that went into another car. What do I do?
First thing is, the best thing to do is call 911 first and activate the emergency service system. Second thing would be to be aware of other dangers that are happening at the scene of the accident. You don't want to have other cars crash into you. You don't want there to be fallen wires or hanging tree limbs or any other dangerous things that could make a bad accident worse.
What if I'm in the car? How do I know whether I have something to worry about, if I'm passenger or the driver?
If you're a passenger or a driver, well, things that would upset me and make me be concerned is if you've had loss of consciousness, if the airbags have deployed and hit you in the face or the chest.
What if I'm bleeding?
If you're bleeding, probably the most important thing is to apply pressure.
Show me how.
I'll show you how we can do that. Say our patient here was bleeding from a head wound. You would take just anything. It could be paper towels, gauze, handkerchief, whatever, and just put pressure. Even direct pressure helps. And if you have something that you could wrap it with, a dish rag, a cloth, a scarf, you can take it and wrap it right around the head like this.
What if I think I have a broken bone? What do I do then?
If you have a broken bone,
like an upper arm or
like
something?
Like an upper arm, say he had a swollen arm here that we suspected to be broken. You could take a board, say, anything hard, even a bunch of magazines would work. And if you put them, say, on that area and you held it, then you could take another type of scarf or wrap. I mean, obviously I'm using an ACE wrap because I have it here in the hospital. But something like this would be a great way to immobilize a broken arm.
What if something's sticking out of me? If I get glass in me, something like that, what do I do? Do I take it out?
You mean like an impalement, right?
Yeah. You take it out?
No, you never take it out. You normally leave those
Good luck,
types...
sir.
Thank you, sir. You normally leave those types of injuries alone because many times the emergency responders will transport you to the hospital with that object still inside you. They may cut parts of it away.
Now I'm in the emergency room. What do I do? I'm bleeding. What do I do? What's the first thing I do to get resuscitation, get fluid into me?
A common thing that comes in. Patients come in. We worry about the A, B, C, D, and E's. Airway, breathing, circulation, disability, and exposure. And what we'll do is make sure that they're breathing, and then we'll use certain modalities. Like, I mean,
rapid infusion.
We have rapid infusion.
You can get fluid right into bones with this thing?
Be careful with that.
Okay. And yet you take x-rays. You got a CAT scan here.
We have x-rays here. Traditional x-rays, which will help us rule out broken bones. We have an example of a CAT scan here. These will give us a good look-see into your chest and your abdomen.
Ainsley, back to you.
Hey, Dr. Siegel, what do you do for recovery after you visited the hospital?
That's a great question. What after you leave the hospital, especially if you're a child, and they send you home from the ER? What do you do then?
Oh, if they send you home, then the parents are going to have to be careful to keep an eye on certain changes in your behavior. Maybe you're getting nauseous, starting vomiting. That would indicate a head injury. Say you start having abdominal pain, or you're also not tolerating anything by mouth. These are signs and symptoms that would concern me that maybe the child needs to get brought back.
Ainsley, great point there. Look for changes of behavior in your children after they've been in a car accident. Further questions we want to answer on our Facebook page. Ainsley, back to you.
All right. Thank you, Dr. Siegel. Great advice. Dr. Siegel's 5 Minutes to Live series continues tomorrow. Tomorrow, we're going to be focusing on what to do if you're outside, you're working on your house, and someone falls off of a ladder.